Hi, my name is Sarah, and I'm with the Physical Therapy Department at Essentia Health. I'm here today to show you how to do your preoperative exercises and explain some tips to make them easier for home. I would like you to do these exercises twice a day, once in the morning and once in the afternoon. I would like you to do these before surgery because it will make you stronger and make your recovery process after surgery easier and faster. So what's going to happen next is I'm going to walk through each of your exercises, give an example of how to do them, and some tips to make them easier. Exercise 1 is called the ankle pumps. To do this exercise, what you need to do is to sit down in a recliner chair or to lay down on a bed with your legs straight. Then point your toes towards you and then point your toes away. You'll be moving your ankles back and forth like this. This is important because it increases blood flow by pushing the blood from your legs back to your heart. This is good for you to do after surgery because it will increase the healing process and prevent blood clots. Do this 20 times. Hello. Exercise 2 is called a quad set. The quad sets will strengthen your thighs. These muscles are important for controlling your hips and knees. To do this exercise, what you're going to do is push your knees down into the surface below them. This is going to cause your heels to slightly rise, and you should feel the muscles in your thighs working. Hold for 5 seconds at the top and lower down slowly. You will do that 20 times. So up for 5, 1, 2, 3, 4, 5, and lower. Do that 20 times. And down. Exercise 3 is called a gluteal set. I personally like to call them the butt squeezes. To do this exercise, you need to tighten your butt and hold that for 5 seconds. For example, I'm going to tighten my bottom and hold for 1, 2, 3, 4, 5, and relax. You will do this 20 times. This exercise is going to strengthen your bottom, which will give you better support when walking by keeping an upright posture, and it will give you stability when walking. If you have strong hips, your knees will also be supported. So, again, tighten your bottom and hold for 5 seconds, then relax. Exercise 4 is called hip abduction and hip adduction slides. To do this exercise, point your toes towards the ceiling, like that. Maintain that position and move your legs out as far as you can go and in towards each other. It's as if you're making a snow angel. This exercise strengthens the muscles on the inside and the outside of your thighs. It gives supports to your hip and knees when walking. Do this exercise 10 times slowly. Exercise 5 is called a heel slide. To do this exercise, you will need a belt from home. Take your belt and place it around the arch of your foot. Hold the belt on each side. Keeping your heel touching the surface, slide your heel up towards you. This is going to cause your knee and hip to bend and slide it back out. This should be a slow and continuous motion. It may cause discomfort. That is okay. But do not push through discomfort and push into pain. The goal of this exercise is to decrease stiffness in your joints and increase blood flow, which will allow for healing to occur faster. Do this motion slowly 10 times. Exercise 6 is called short arc quads. This exercise strengthens your thigh, which gives stability to the hip and knees. To do this exercise, you need to place something under your knee. You can use a rolled up towel, as I have right here, or a rolled up pillow, or if you drink coffee, a coffee can is about a perfect size. Place whatever you have under your knee. While maintaining contact on the rolled up towel, lift your lower leg into the air to straighten the leg out. As you can see, my leg is straight right now. Hold for 5 seconds at the top. The hold is going to strengthen your thigh. Once 5 seconds has occurred, slowly lower your leg back down to the ground. Your leg should not thump on the ground. Do this 10 times. Long arc extension. To do this exercise, you need to be sitting in a chair with your feet touching the ground. You are going to slowly lift your lower leg up so that your leg becomes straight. Once your leg is straight, hold for 5 seconds. This is going to strengthen your thigh muscles. Once 5 seconds have occurred, slowly lower your leg back down to the ground. You are going to do this exercise 10 times, each time holding at the top for 5 seconds. Exercise 8 is called calf rises. To do this exercise, I want you to be holding onto a steady surface. So I will be holding onto the back of this chair. You are going to slowly raise up onto your toes and slowly lower back down. You do not need to hold this exercise at the top. The motion just needs to be slow and controlled, both on the way up and on the way down. This exercise strengthens the back of your calves, right here, and it will make walking easier and help improve your balance. Do this exercise 10 times. Exercise 9 is a weight shifting exercise. To do this exercise, I still want you to be holding onto something steady. Take a step onto your bad leg forward and shift your weight onto your hip. This is going to represent walking, where you have to bear weight onto your joint. And take a step back. Do this 5 times. This is going to help strengthen the muscles around your joint. Stronger muscles will bear more of the forces, allowing less muscles to be put onto your joint bones, causing you to have less pain when walking. Exercise 10 are standing mini squats. To do this exercise, hold on to a stable surface. Keep your feet shoulder width apart. You are going to bend your knees slightly and unlock your hips so that your trunk moves slightly forward. I do not want your knees to move past your feet or past your toes. Slowly lower yourself down so that your knees are bent and you unlock your hip. You should feel the muscles working in your thigh and in your butt. And lift back up. Do this 10 times slowly. Exercise 11 is called a hamstring curl. To do this exercise, you need to be standing and holding onto a stable surface. You are going to lift your leg up and slowly lower back down. This will strengthen the muscles behind your knee and help make walking easier when your leg is swinging through the air. Do this 10 times. Exercise 12 is called seated arm push-ups. To do this exercise, you need a chair that has armrests. Sit at the edge of the chair so both your feet are touching the ground. Place your arms on the armrests and slowly lift your body up into the air as if you're rising from a chair. Hold at the top and lower slowly. You are going to do that 10 times. This is going to strengthen your arms to get prepared for using your arms more after surgery because you will be using crutches or a walker for at least 2 weeks to get around. You have just finished watching your preoperative exercises. As a reminder, these exercises should be performed twice a day. This will help make your muscles stronger and help better prepare you for surgery, making your recovery process after surgery shorter and easier. I expect these exercises to cause a slight discomfort, but they should not cause pain. So with that said, do not push through your exercises into pain. After performing the exercises, I recommend icing your joint for 20 to 30 minutes. Icing will help control pain, swelling, and inflammation. Thank you for watching and good luck with your exercises.